Chaps, I've got Tom. Tom, you messaged the page whenever it was, a couple of days ago, whatever else, saying that you want to do a marathon, and that's awesome. Thank you for supporting us. I still think you're mental, excuse the expression, considering it's a mental health charity. And I know someone took offence because I was like, "You're undermining people who do marathons." I'm like, people who want to run 25 miles,
26.
20, oh, there you go. Every little counts. 26 miles on the pavement.
Yeah.
That's mental. And why you'd want to do it to help like a charity or stuff like that, it's just mental. But like I said to you the other day, mate, it's just financial stuff always helps out, especially this year. Let's not beat around the bush. The cost of living is not going anywhere. So every little helps, as the mighty Tesco say. But we're more about why you're doing it.
No, that's.
Sorry, mate. Chuck you straight in there, mate. Sorry, mate.
That's all right. For me personally, kind of obviously running the marathon is, but from a personal point of view, I enjoy running, so I've always wanted to do it. It's always been on my bucket list to do. So that's kind of from the kind of physical side of it, and then I think from kind of the motivation to do it. Obviously, I'd wanted to help out a charity. And a lot of the ones kind of you get pushed towards are kind of the mainstream charities, the ones that you kind of see on a daily basis, whether it be advertised on TV or you've kind of hear about through kind of advertising. But I wanted to do something that was a bit more personal to me. And I've kind of had mental health struggles probably since the age of about 13. So coming up for 18 years now. That's kind of been a bit of kind of anxiety. So whether that be a bit of social anxiety, kind of anxiety around kind of my self-esteem, my self-confidence. And then that's also kind of led me into periods of depression and kind of feeling very low within myself. So I wanted to find kind of a charity that really kind of focused on those issues, and one that kind of really focused especially on the kind of men's mental health, because I know that's something that's not spoken about enough. And having experienced it personally, knowing that it is very difficult to actually speak up and to kind of get the support that you need.
Was it difficult for you in your life pickles?
Yeah, because I think certainly when I was kind of a teenager and kind of going through school and then into university, I didn't really understand why I was feeling the way I was. I think for me, I always attributed it to kind of just that was just how I was as a person. I was quiet, I was reserved, didn't want to kind of put myself out there too much. And it's only since I've actually opened up and started speaking to people about it, it's actually allowed me to understand the reasons behind why I was feeling how I was.
Was you? I'm being massive. I'm going to sound judgmental, and I don't mean it to be sound judgmental. You just seem like one of those blokes. I'm going to presume lads where you just fitted in. So you stay under the radar.
It was
wrong. I'm just presuming.
No, I've always kind of going through school. We had quite a big group of friends. It was quite a big group of us. And yeah, so I was always kind of involved in stuff, whether it was kind of like doing sports, kind of house parties, going on nights out, things like that. But I was never kind of at the forefront of the group. It was always like I was a part of the group, and it was just kind of I was just there more than anything.
Yeah. Do you think that was hard? Do you think that's why it was you was unnoticed?
Yeah, I think so. I think because I always kind of felt, because I wasn't kind of one of the big voices in the group who was kind of always say make cracking the jokes, or the ones who was kind of the life of the party, almost wasn't kind of confident in going up to other people and kind of speaking to them. And it was always kind of a case of I'd only kind of speak if I was kind of spoken to.
Yeah.
Because I didn't feel like people would want to kind of be interested in what I had to say, and it come across as though it was just like, oh, he's just going on about some boring subject again that none of us want to hear about.
Yeah. So how did you see the light? Excuse the expression yet again. How did you get past that and to where we are today? Because you seem quite content with You?
I think for me, I think I'd always had a lot going on that kind of distracted me from those problems as well. Because for me, it was always was quite academic. So it was always kind of a case of just focusing on kind of one block of exams after another. So kind of going through GCSEs, A levels, university, and then when I started working, doing an accountancy qualification as well. And it was only when I finished doing all those exams that all of a sudden I had no focus to distract myself.
Yeah.
And I had a couple of incidents which I would describe as kind of an emotional breakdown, where all this kind of emotion and all these kind of feelings just came out, and they all not in any sort of kind of logical order or anything like that. It all just kind of started pouring out, and I think and that happened about 3 times in the space of a month.
Right. Okay.
And it tended to center around kind of, I'd been out kind of and I'd had a few drinks, so kind of allows you to feel a little bit more kind of free anyway, and a little bit more, for me, it makes me feel a little bit more emotional anyway. But I think after having those events, it made me realize actually this isn't just this is how I feel. This is actually I've got an issue here, and I need to understand what's going on.
Yeah.
So the first step for me, I still didn't feel ready to kind of talk about how I was feeling in detail. But the first thing for me was just saying to my wife, I need some help. And she just said to me, well, do you want me to contact the GP for you? So that was kind of the starting point for me.
Yeah.
Like I said, I didn't want that big conversation. I didn't want to have to go into detail on it because I didn't feel like I was ready to.
Yeah.
I knew that I needed some kind of professional help.
Yeah. So did your wife notice before you did?
I think she kind of noticed that was just a little bit, maybe just a little bit. I think she'd always noticed that I was quiet and I was kind of quite withdrawn, and I don't think she'd necessarily kind of understood fully, but I think she knew that something wasn't quite right, just with how I'd started not enjoying the things that I'd kind of enjoyed when we first got together. So like I was always quite big on exercising, so running or going to the gym. That had kind of dropped off a little bit, and then kind of my eating kind of was more into kind of snacking on junk food and takeaways and that sort of thing.
Yeah.
So I think that was kind of a bit of a sign that I was kind of going through something.
Yeah.
So I think she was quite relieved when I said that I needed help, because I think she knew something was wrong but didn't quite know how to approach talking about it with me.
Yeah, no, it's such a hard one, isn't it? And this is what annoys me about. Obviously, I get tagged in so much stuff when it comes down to like mental health now. It drives me mad actually, because it's just like non-stop sometimes. And you see all these articles of like, ask them how they are, ask twice, and all this kind of stuff. But actually, the trouble with mental health, or people with the start of mental health issues, I'm not going to say illness, but the mental health issues, there is no one size fits all. And I think that with me now, I've got our chair trustee, who's Steve. He knows me very, very well. Probably, well, him and Dot, they know me better than anybody else. And if they see me having a bit of a wobble, they're like, Dot, bless her, she's like, right, Dan, but she'll drag me out of the office, say, right, we're going for a coffee. Steve, on the other hand, he's like, Dan, you're being a prick.
Yeah.
But obviously that wouldn't work for you.
Yeah.
And actually, and I applaud your wife. Obviously, I don't know her and all this kind of stuff. At least she was just seeing, by the sounds of it, seeing where it was going and just there when you needed her.
Yeah, and I think because I think because I still felt it was obviously the first time I'd really admitted that I needed help. I think there was a little bit of that, use the word stigma, of feeling a little bit ashamed of it.
Yeah.
And I think the way she handled it in terms of just being like, well, I'm not going to try and kind of talk to you about it. I'm not going to try and necessarily give you advice on it. I'm just going to kind of see what you need, and what I needed was to speak to kind of a professional.
Yeah, no, absolutely. It's funny actually because you say stigma. Obviously, I'm always spouting out about stigma. It's our hashtag. What we're trying to own is man up stigma. But you use, and I'm seeing this. You use the word admit. I admit when I felt I don't want to misquote you because I've got a memory like a fish. I've hit my head way too many times. But you use the word admit. When you admitted that things were going a little bit wonky. And I find that of other blokes as well, they use that word admitted. So what have you got to admit? Life's just a little bit naff at the moment. Give us a hand.
Yeah, yeah.
Do you get what I mean?
Yeah, it's an odd way to kind of phrase it, I suppose, because it's not something you've done. It's just how you're feeling at a particular moment in time, and it feels like you kind of. It does feel like you're saying that's. For me, it feels like you're saying something's wrong with you when it's.
Yeah, it's interesting. I don't know where this is going to go, but it's interesting that you just said that. The reason I've heard you say it is because I think my therapist, I've like weekly. I tried to stick to weekly therapy, and I think the therapist said to me was just like, why are you saying admitting? So I don't know. It's like women don't say that. And
Yeah.
I don't know. I don't know. I'm going that one. So sorry, but it's interesting, isn't it? Why blokes say I admitted to having mental health issues or mental health. I admitted to. I don't know if you just rephrase it. Just someone's just not right.
Yeah.
You're not admitting anything. You just I don't know. Sorry, I've taken it on a tangent. So I do apologise, mate. So how did you get to the moment where you're at now, where you're like, I need to deal with this? I know obviously it sounds like your wife might have nudged you a little bit, but
Yeah, so I think it just made me realise that it was starting to affect my life. It was affecting kind of my personal life in terms of the things that I enjoyed. It was starting to affect my relationship with my wife as well, because I was a little bit more kind of I didn't really have as much, say, tolerance. I was a bit kind of short with her at times because
yeah,
I didn't know how to deal with how I was feeling. So I think, and then it was starting to affect my work as well, because my work role was quite outward facing, so I had to deal with quite a number of different people, and it was leading me to become a bit more withdrawn in my work as well. So I kind of knew that I needed to change something because I wanted to learn how to cope with these like feelings I was having and how to kind of manage them so that they wouldn't affect my life on a kind of as much on a daily basis.
yeah. So I presume like you've kind of learnt your triggers and learnt to live with rather than
Yeah,
suffer from.
because once I spoke to the GP, they referred me onto a local to my local NHS trust for kind of cognitive behaviour therapy.
Oh, the whole
And I kind of
CBT.
yeah,
Yeah.
and I did a session every other week for about 8 months, and that
Okay.
I
Yeah.
found that really useful because it really kind of provided me with one kind of an understanding of why I felt the way I do, but also kind of gave me some really good coping mechanisms to kind of spot the signs of if I was kind of certainly on like the social anxiety side, kind of understanding how to go about kind of mitigating the
Yeah.
feelings. And I think for me that really helped because it also gave me a bit of we kind of with my therapist we kind of dug into my past as well
Yeah.
and kind of took it right back to kind of childhood, and it actually helped me to understand kind of some of the reasons why these feelings kind of existed in the first place.
Yeah. So let me just ask you. I've had a couple of conversations about the whole CBT. Even if let's just pigeonhole that into therapy
Mm-hmm.
for the moment. And one of the things what really frustrates me is people say, "I've tried therapy, all CBT, but yet again, I'm pigeonholing all of that and thing." So and it didn't work. So how many did you try? Oh, I just went once. And even with me, with my therapist, bear in mind, I have walked out of therapy, not the therapist I'm with before. I have walked out of one session before, just saying, what a waste of time. So I am part of the problem. How many weeks did you do, or when did you go? Actually, this is working.
I think it was probably after I'd done about 6, because the initial 6 weeks were kind of half-hour sessions, so they were more of a kind of introduction to it. And I think at the end of the initial 6 weeks, I was like, actually, this is starting to make a difference, because I was like, I understand better now. And then that was when I moved up to kind of the more intense kind of 1-hour sessions. And I think by the time we got to the end of that kind of course of sessions, I think I was very much like, I've got this. I know how to manage this.
Yeah.
And I think there was probably a part of me that was a little bit naive when I finished that initial course of therapy, because I think in my head I was like, right, I've got the answers now. I can do it. And that was fine for kind of 2-3 months. But then I think I got a little bit complacent with it and kind of let my management of it slide
a
little bit, and then kind of started to fall back into a bit of a towards kind of, as I'd term it, an emotional breakdown again. To the point where I got to a point where I was just like, you need to get help again. And
do you think? Sorry, I interrupted. Do you think it's kind of like that? What you're saying, I get it, because I've done it with therapy, where you're like, oh, I'm all right now, and then you kind of, and I think it's the same. I don't want to get in the whole debate of, obviously not with you. People are commenting, just shut up, or will be commenting. It's just when people are given antidepressants or anti-anxiety, whatever mental health drugs, let's face it, that's what they are. They overdo them for a couple of days and go, they're not working, then they stop. Or they take them for like a couple of weeks, they start kicking in, life's great again, and then they stop. And then it starts all over again.
Yeah.
Would you say that's kind of that pattern, what you did?
Yeah, I think I almost just kind of thought, well, I've almost kind of like how I'd do for, say, like how I'd term it as how I used to do for an exam. Like, I'd study for it, do the exam, be like, I can do this, and then afterwards I'm like, okay, I don't need to do the work anymore. And I think that's kind of what happened to me. I think I forgot that I still had to put the work in, and I think going back for a second round of CBT, I think after, when I came out of that, I was like, right, you've had your little wobble, you've realized that you needed to kind of go back and kind of talk again and get the help again. But let's not allow yourself to get into that situation again.
Yeah, no, absolutely. But by the way, just because I'm smiling, it's not like I'm smiling. It's just, it's nice to hear someone else go through. I don't mean how that sounds. It's nice to hear somebody else actually kind of go through the same thing, because I've been there, done it, walked out of therapy and I've stopped the happy pills and all sorts of people. This is ages ago, and you end up just stuck in that little roller coaster for a little while, isn't it?
It's very up and down kind of, I found it to start with.
But in a nutshell, it really is about learning your triggers, isn't it? And learning to, and I've said this throughout MANUP, it's sometimes mental health, well, it's not sometimes, in my personal opinion, nothing to do with the charity, blah, there's my disclaimer. We have to learn to live with mental health.
Yeah, absolutely. And I think that's what I've realised. It's not something that, for want of a better word, I'm going to be cured of. It's something that I am going to have to live with, and there are going to be times when I am going to probably feel low, but I know now what triggers me, and also now I feel like I can talk to people about it. Like, I think that was part of my problem. I didn't know how to tell people how I was feeling, like my parents or friends, and now I feel like I'd probably about 3-4 months ago, my mom said to me, she was like, "Are you okay? You seem a little bit off." And I think that was really nice to hear, because it means that the conversations I've had with them previously have kind of they kind of understand,
Yeah,
and kind of know what to look out for.
because you've made mental dealing with living with mental health a normal process.
Yeah,
Because it is that. It is, isn't it? Dealing with your mental health is just like dealing with your physical health. They're both
yeah, well, yeah,
entwined.
absolutely. And I because I was always adamant that I wouldn't go on to antidepressants. I was always adamant that I didn't need them, that
Yeah,
it's just something I don't need. And now I've been on them for almost 12 months, and it's just a daily routine. I get up, have my tablet with some water, and get on with your day, and it's just part of my life.
there you go. If you're a happy bunny and getting on with stuff, then job done, isn't it? Really.
Yeah.
So if anyone's just before George, I just realised we've bloody gone through it. Bloody hell. If someone is watching this, right, we're going to jump into the whole bit. If someone's watching this and they can relate,
Yeah.
what would you? And there will be some. What would you? What's your advice?
I think for me, it's kind of, you don't, if you do feel like you need to talk, don't feel like it has to be everything. It doesn't have to be in depth about exactly how you're feeling. It doesn't have to be all the details of everything that you've felt over a period of days, weeks, or months. It can literally just be as simple as, I need help, or I'm struggling. It doesn't, like, because if someone hears that and someone cares about you, they'll support you. They won't judge you. They'll just help you to get the help that you need to kind of get you through it.
Yeah. And would you agree, even though I called you out on it, just because I've done it myself, you don't have to admit anything.
Yeah, you don't. It's not, you just have to understand it's something that you're feeling, and it doesn't last forever.
Yeah.
You do come out of it the other side. It can just take a bit of time, and you can have ups and downs on the way.
Yeah, absolutely. That was a good call. I hate saying I enjoyed that, because we're obviously talking about mental health and horrid moments, or whatever. But this is one of those calls where, or Zooms, whatever, where you just like, it's just nice to have an honest conversation between two blokes or another bloke, and just, yeah, that's it. And yet again, sorry for grinning through or smiling through some of it. I wasn't laughing. I'm just like, it's nice to hear somebody else. It's not just me.
Yeah.
You know
It
what I
just
mean?
makes you feel better that
No, it does.
you're not alone.
And no, it's just nice to know that there's other fuck ups out there who are just plodding along with their life and just learning to enjoy it the best they can. But anyway, let's draw to a close. How I'll do the whole taggy thing, but how your marathon, still thinking mad for it. But yeah, again, thank you so much, mate. But how would one find you to donate or whatever?
So I've got a just giving page for that. So I'll be sharing that on my Facebook and Instagram pages. And yeah, obviously every little helps towards supporting a great cause.
No, it does. It's a massive help. It really is. But yeah, again, yeah, we'll always welcome that. But for us, it's more about that awareness, and this is why I wanted to pull you into a story, into a Zoom, because I'm like, I think a couple of people watching might learn from this conversation.
Yeah, absolutely. Anything that kind of gets the awareness out there is great.
That's what MANUP's all about, mate. But let me hit that record button. Bear me 1 second, fella.